Craniosacral therapy is a very gentle energy and manual therapy. Using his hands, therapist applies gentle pressure in different areas of the client's body. The healing process is guided by changes in client's craniosacral rhythm, which is being monitored during the entire session by the therapist. In very basic terms, the craniosacral system is the nurturer and protector of the central nervous system that allows the therapist to work not only with the cranium, but with the entire body of the client. The human skull is a puzzle box made out of many different bones. Some of those bones have very limited range of mobility. This mobility is an important part of the system controlling the pressure within the brain. Some craniosacral techniques are specifically designed to improve the mobility of those bones, in return promoting healthy and optimal pressure within the skull and the brain. During the session, therapist creates gentle and peaceful environment, inviting and promoting the necessary corrections in client's condition. Under the direct supervision of client's holistic system, using intentions, energy, physical touch, and specific techniques, therapists guides and supports the natural healing and self-correcting ability of client's body and central nervous system. In addition to addressing specific conditions and illnesses, craniosacral therapy offers 10 steps protocol designed by Dr. John Ablager himself. Basically, this is a tune-up for entire craniosacral system, removing restrictions and improving its functions. Hello, I'm Robert, founder of Healing Simple, and I would like to thank you for watching this short video and also encourage you to find out more about craniosacral therapy and try it for yourself. If you have any questions about craniosacral, somato-emotional release therapies, or healing in general, you can contact us. Thank you and be well.
Therapists follow a few basic tenets in craniosacral therapy. We believe that the body has a capacity and knowledge to heal itself. Even genetically, when we have a problem, we still would like to try and work with that genetic component to see if anything could be benefited. We trust in the body's wisdom. We meet the client where they are. It means if a client comes to me just needing a wellness checkup once every few months and they're doing okay, I just treat them exactly where they are that day in that moment. And that likewise, if a client comes in completely distraught, having a very difficult time because of pain or chronic illness or family issues or trauma, I try and meet them where they are and work from that point. We use the craniosacral rhythm, which is the CSR, and clues in fascial tension. Remember, fascia is also collagen, to help guide the session. So we learn about what's going on in the body by how the body feels in our hands. We treat people. We do not treat disorders or syndromes or diseases or illnesses. Those things all make up a whole person, and that person has their own experiences, their own history, their own everything. And so we try very, very hard not to say we're treating Ehlers-Danlos syndrome today. That's a very important part of our training is to look at it holistically. And we strive always to provide non-judgmental, neutral healing environment. So when you come into a craniosacral therapy clinic, you are not judged at all, ever. And I hope you all have that experience with a good craniosacral therapist. Treatment sessions are very, very relaxing. You stay clothed. This is not some shoot off of massage therapy. Usually a session is about an hour long in a clinical setting. Therapist's hands are on the body. So this is a manual therapy, which means hands are on the body, versus an energetic therapy where the hands may be off the body. Some craniosacral therapists are trained in both ways of treatment, but if they're saying they're doing craniosacral therapy and their hands are off the body, they're doing something else. I mentioned already, we're already trained. We're trained to find restrictions in the fascia and then encourage the restricted fascia to reorganize into an improved. So we're looking for a place of ease for that tissue to be, not one of restriction or tension. We allow the body to guide us into that position, and our hands help facilitate the body's desire to be there. All levels of therapists, new and advanced. So from someone who just came out of their first level class to someone who's been practicing for 25 years, all use the same basic principles. However, the more training, the more hands-on work a therapist has, the more efficient and fine-tuned the treatment, just like any other job. The next series of slides are just going to be pictures of where you might see or find hand placements in a typical session. The next couple slides will be on what we call diaphragm releases. The diaphragm release in craniosacral therapy is an area of sort of concentric or circular tissue where longitudinal fascia, which goes up and down the body, intersects with horizontal fascia, which goes across the body. And we have a number of those areas in the body, and because there's so much fascia intersecting with one another, they tend to be areas where restrictions will occur. We use these spaces as areas to find out more about musculoskeletal hangups on the central nervous system. So the picture on the left is a pelvic diaphragm. My right hand is under the sacrum and L4, L5, and my top hand is just north of the pubic bone. Sometimes I am against the pubic bone. This second picture, my hand is a little further up the spine, my lower hand, my right hand, at T11, 12, L1. And my top hand is on the lower part of the rib cage. Next two diaphragm releases, we have the thoracic and the hyoid diaphragm releases. The thoracic is my left hand is connecting with the clavicles on the top of the chest and sternum area. My bottom hand is in the upper thoracic, C7. The right hand picture, my two fingers, my thumb and index finger, are on the farthest edges of the hyoid bone, which is a horseshoe-shaped bone that floats in the neck and is suspended by a number of muscles. Those of you who have Eagle syndrome will have a calcification of one of these muscles, and that muscle is the stylohyoid muscle. But some functional theories to think about are that if we're unstable in that area, the body is trying to stabilize us by calcifying these muscles. Unfortunately, the body does not understand that it's also causing a lot of pain and dysfunction for people. So again, my top hand, my thumb and my forefinger are on the hyoid, and my hand under the body is on the cervical spine. This, by the way, all of these positions, the pressure is extremely light. It's not heavy. I'm not squeezing. I'm not leaning. It's very, very light and delicate. OC1 and frontal, I'll just talk about OC1, which is on the left. It's technically it would be the OCB release, which is occipital base release. I've chosen to write OC1 because occipital C1 release. Many of us have craniocervical instability, but in the general population, we often find that occiput and C1 are kind of jammed together and not free to move. Our occiput is meant to glide on a beveled surface on C1 so that we can turn our head and take impact, surprisingly enough. Okay, we need to be able to be, our body needs to be able to move. So our body's designed to take impact or change position. But oftentimes when we have a compaction of occiput to C1 and that beveling surface is jammed and not moving well, we have a lot of pain and discomfort, headache, brain fog, a lot of things you guys experience, which is also experienced in the regular population. So it's difficult to see my hand placement here, but there are a number of steps that I do in that particular placement, which is the left-hand picture. One of the first steps is just sort of soften the tissue there, and these are the suboccipital muscles, which can become very tight for people. And then I would put the person in a platform. A platform is lifting. It's difficult to describe how the way that happens with this picture, but it's a lift onto C1 to allow the occiput to glide away from it. The next step after that is to bring a little bit of distance and a minor bit of traction between C1 and occiput. The next step after that is to actually do a spreading, a myofascial spreading, which helps to open the foramen magnum, which is that space where, for people with Chiari, the cerebellotonsils herniate through. So if we can open that space a little bit, it can relieve some of the pressure in Chiari, although we wouldn't do the platform, okay? And I'll talk about Chiari things later. And then for normal circumstances, we would then just do a little tiny bit of traction down the whole dural tube. We call it, the dural tube is the dura that surrounds the spinal cord itself. So we have the dural tube and we have intracranial dura, which is the dura around the brain. On the right hand side is a picture of a frontal release. Again, these pressures are very light. Next series of pictures actually from frontal on, for a couple more slides, are all to decompress the skull. Now, we all have sutures in our skull, and sometimes they get compressed. What we want to do is try and make sure they're not compressed. And when we can decompress them, the cerebrospinal fluid has more options of places it can go. And the more the CSF can travel to those areas, the better flushing of nutrients, or flushing of toxins, and replenishing of nutrients to that area, thereby increasing the brain's health. And hopefully, if the brain is feeling healthier, it works better. Okay, Kim, I'm ready. Thanks. These next two are just two more pictures of this same kind of decompression. On the left is a parietal decompression technique, and on the right is a sphenoid decompression technique. Both of these, again, are to address the sutural restrictions in the cranium by reducing those restrictions in any sutural. Let me start that over. Reducing sutural restrictions helps to improve brain functioning. Okay, so we also do temporal bone release. A temporal bone is kind of a funny little bone, and it causes a lot of problems. So we have two of these bones. Actually, we have two of a lot of the cranial bones. So these are just pictures. I'm showing these pictures to you so if you experience craniosacral therapy, you know what to expect. Oh, and this one is my favorite. It's the most awkward looking slide, but this is an SI joint release. And the reason I have this series like this is because it is important, since most of us have SI joint dysfunction, but we're not the only ones that do. A lot of other people do. And so to release an SI joint issue, this is a technique that we use. Now, from the picture from the left to the right, the first two pictures kind of show how I access the SI, or the sacrum. And it's a gentle way of doing it. It looks silly, but it's actually a really nice way of getting my hand position and keeping integrity for both myself and my client. So, and then the third picture is difficult to tell. Third and fourth are difficult to tell, but I am in a respectful space, actually, and most clients do not find this awkward once I'm in this position. So here I can actually hold on to the entire sacrum and feel where it's restricted, whether it's turned or twisted, and we can help release that. It really alleviates a lot of low back pain. So I know it looks ridiculous, but it is very, very helpful. So last couple of pieces of a craniosacral session are sort of a head to tail, a dural tube mobilization, which is on the left, a head to tail sort of gliding action. My left hand's under the sacrum, my right hand is under the occiput. We have a full series of protocols for TMJ issues and release, including, which I don't show, including intraoral work. So I would put on a glove, I'd go in the mouth, and we would loosen up restriction. The temporal bone release from a couple slides ago, that's when my finger was on the client's ears, also helps with TMJ issues quite a bit. The last little piece is called a still point. In Ehlers-Danlos syndrome, I don't particularly recommend a still point, and I don't normally do them, but it is a nice place for people to go to be able to relax. A still point has a way of inducing deep, deep relaxation. Still point is, I do not recommend still point for EDS because of some of the intracranial pressure issues that we may have. And the still point might interrupt the pressure a little bit more than we would want.